It's a lot of moving parts today. We are conducting an evacuation exercise in South Frisco. It affects three main areas. The South Frisco area of the mountainside, the Ophir Mountain and Medical Office Building area, as well as the Bills Ranch area. Well, the scenario itself is that we've had a weather situation move in the last 24 hours, and there's been some dry lightning strikes. Those lightning strikes have resulted in a smoldering fire in 4 different areas around the Rainbow Lakes area. We know that there is weather conditions that are not adverse to fire. We know that there's some hazardous conditions possibly on the way. We know there's significant ground winds, and what we're trying to exercise today is a coordinated evacuation response from law, obviously ambulance services, the county, as well as fire, in order to get into those areas, notify people through the communications center, through reverse 911, and also going door to door and advising people of the need for an evacuation. Obviously it's an exercise, so we're not actually asking people to move, but we're trying to simulate that resource need of getting out into the community and notifying people and telling them 2 messages. 1, that it's time to go because there's a threatening condition in the area, and 2, telling them where to go, identifying relocation centers and getting people to a safe area and providing assistance there so that we can get through this. Well, you know, we've been working very hard on plans and procedures, but periodically you got to sit down and make sure that those plans and procedures that you've got down on paper are working in a real-world situation. And so that's what we're trying to simulate, is a real-world simulation today, taking those checklists, taking those procedures, and getting people in boots on the streets and knocking on doors to make sure that those work. And after this, what we'll do is we'll come back together, we'll look at an after action and see what lessons we can generate to make them more seamless.